Migraine is something that a lot of people live with in silence. And I just think that's just so undervalued. It's really not acknowledged enough and it's not talked about enough.
Living with migraine means fighting two battles every day of your life: the battle to function and feel better, and the battle to be heard, seen, and understood. I'm Allie Canizzo. Welcome to the Migraine Circle podcast by CEFALY, the podcast that gives you expert insights and practical tools to help you manage migraine and get back to life. Today, we're hearing from someone who lives and breathes the mission of helping people with migraine every day, our very own Cali, an account manager here at CEFALY. Cali is an account manager for our veteran medical centers, and she helps with our private practice and Mayo Clinic providers. Cali, thank you so much for joining the podcast.
Hi, thank you.
So how about let's start with you telling us all a little bit about yourself and what you do at CEFALY.
So I work at CEFALY as an account manager. I help onboard our providers and I also help some of our patients. Before being with CEFALY, I worked in the medical field on the front lines, actually in the surgery department for 12 years. And I worked in a wide variety of different specialties and types of surgeries, anywhere from pediatrics to adults, which has really helped me when I onboarded with CEFALY have that compassion and that empathy that it takes for some of our patient care that we see.
So what part of the role feels the most meaningful to you?
For me, it's helping patients get the success stories that we see. From where I sit, a lot of what I value in my job is helping find more providers. And the reason that I see a lot of value in that is the more providers that we have aware of CEFALY and that can utilize CEFALY, the more patients that are going to be able to use us and have benefits and get back to life. We know that we are, in many, many places, but there are always new residents that are in their training right now and then are going to be in their own practice down the road. And so for me, I really enjoy getting to meet the new providers, opening their eyes to the value and the missions that we do have here and all the clinical backing that we have with our device, just bringing awareness to the opportunity of it.
And I know you talk a lot with providers and people living with migraine. And was there any story that really stuck out to you or something even you've heard from a colleague here at CEFALY?
I have a couple different, scenarios that really come to mind for me. And I am a mom of three. We're very busy. We do lots of athletics. And so anytime I get to talk to patients that are suffering from migraine that happen to kind of live that same lifestyle, those usually tend to tug at my heartstrings a little more. And that's kind of where these stories go. I have had multiple times, some as CEFALY employee, so actually working on the clock. And then there's been some other interactions just out living life where I find out someone I know or someone on one of our ball teams, their mom or their grandma or their dad, whoever has migraine. And so we've had small conversations about how when it comes to utilizing CEFALY over other options, is the side effects are super minimal. And so patients are able to use our device and get back to life and get back to the ball games and get back to dance and gymnastics and all the things that they're trying to make it to. And they're not worried about what lingering side effect may creep up on them while they're out and about doing life. And I have, a handful of patients that have personally told me like that's been a big game changer for them as they were struggling with side effects with other options.
100%. And I know a lot of people don't realize the impact that migraine disease has on daily life, like you say about going to the ballpark or going to dance practice and all that, especially as a mom, too. So, what do you wish more people understood about the migraine community?
I think the most misunderstood thing, and I'm guilty of it until I got plugged into this, system as well, is it is a silent disease. So it's similar to some of like your autoimmune diseases where patients are living with it, but you can't see it. You can't look at somebody and they have a cast on their arm and they've got a broken arm. And so you feel sympathetic for them in the moment. Migraine is something that a lot of people live with in silence. And I just think that's so undervalued. It's really not acknowledged enough and it's not talked about enough. And you'll figure it out if you start asking people, do you suffer from migraine? Because all of a sudden, all these people have migraine that you never knew before had migraine because, again, it's such an invisible illness.
And have you ever spoken to someone who thought they just like had headaches or had something going on that you thought like maybe it's migraine and you helped them get that diagnosis?
I didn't necessarily ever help them get to that point, but it is talked about more than I ever had before. I will say, I've noticed more so in like my female friends, the hormonal migraine. Another thing that like I didn't really know anything about until I started working for Cephaly, and I took it upon myself to kind of deep dive in what does that look like and is it a thing and could we be talking to these women's health providers to help raise awareness to this opportunity there as well. Again, another one of those, my passion is really helping bring the awareness to as many patients as possible. And so I do have a lot of friends that I've talked to over the last just year that are predominantly females, obviously, but about the hormonal migraine world, and them finding out that they do have hormonal spikes and migraines and triggers, and that's what's causing some of their migraines. Most of them already had migraines. They were struggling figuring out like what their trigger was. And so kind of even bringing awareness to the opportunity of it, it could be this based on knowledge that I learned here.
And it's always helpful to track because once you actually start tracking it and putting it on the calendar, you might start to see, like, I'm normally getting it this time of the month. It all starts to make a little bit more sense.
Yes, and it's so funny because it's something so simple like that until someone tells you, like, "Hey, if you would track X, Y, and Z things, you might be able to pinpoint that." Like, we are creatures of habit, and so something that's out of the normal, even as simple and as common sense as it may seem, it's not sometimes. And so, always speak up, be an advocate not only for yourself but for your friends and family.
Of course. And then what do patients or clinicians share that people outside this world might not see?
The success stories. So we have a lot of providers that will come to us about not only their patients with themselves that are now using it and how they're seeing it affect their day. And so I love that a lot of our providers have become believers because they're using it themselves. And there's no better testimony than that. If you're sitting in a clinic space and your provider says, I want you to try this device, but when they say, I want you to use this device that I use, and this is why. So I love hearing those stories. And I also love from the clinician standpoint that patients are able to trial it in clinic a lot of the times with these providers before going home and being expected to use it. So if they are a Cephaly certified provider, most of them have a demo unit in their clinic. And so they're able to actually trial it on the patient, let them feel what it feels like. And then they go home really confident and excited about starting their therapy sessions at home.
So you talk a little bit about a CEFALY certified provider. Could you say a little bit about what that means and how someone could find them?
Yeah. So on our website, we have a certified Cephaly provider link that they can go on and they can look. They can put their state that they're in and it'll pull up providers that have done training with us. And so we offer training to all of our providers that would like to use Cephaly in their clinic. And they can then choose to become Cephaly certified. They get a certification and it also allows them to then be on our website so that patients can easily find them in their area.
And do you find with providers in general, are a lot of them aware of neuromodulation as a tool?
It kind of varies. It's funny because with my team, we're in all different regions. And so we have some territories that are very knowledgeable, very open to the idea, and are very aware of neuromodulation. And then there's other areas in the US that maybe know that it's there, know that the studies are being done, but they don't actually know who the companies are that are doing it. And so sometimes it's not even just Cephaly that they haven't heard of, it's all the other options that are out there as well. So that's always a fun conversation to have too, because they might know about it, but they don't know the details of it or how it works. And they certainly don't know the success stories and the outcomes that we see.
And for any of our listeners, maybe they've heard of Cephaly, but they don't really know how neuromodulation works. What would be like the brief overview you would get them?
So, a real quick, down to earth way to explain neuromodulation when it comes to migraine is your migraine is set off by triggers to a particular nerve in your brain. And so, what we're doing is we're triggering that nerve to help relax it, we're helping desensitize it. And so, you're getting less triggered. It's an option that allows you to do a therapy session versus like a pharmaceutical. With that being said, we're not contraindicated for pharmaceutical use or even other devices or therapies. So we're a tool, we're an extra usage for you that you can get to that that part of pain freedom and that space of back to life and not being so anxious about your migraines.
Yep, here at CEFALY, we always talk about the migraine toolkit, so it always helps to have as many tools as possible in there.
Yes.
So, Callie, you've been collaborating with the Mayo Clinic, which is one of the world's best hospitals for patient care and research. Could you tell us something you've learned from working with them?
Something that has been really exciting with being able to work hand in hand with the Mayo Clinic is seeing their innovation with not just neuromodulation, but other studies and trials and things going on. They're very, very, experienced. They're very well knowledgeable. They are in the realm of not just migraine, but neurology in general. And so it's always fun to be able to talk to people that are so intertwined in our specialty and see what they're doing and then how they're utilizing what we're doing for their patients. And so that's been exciting for me just because, if you do know who the Mayo is, when you say the Mayo Clinic, you kind of, perk your ears a little bit. And so to see that they don't just, you know, use us, they believe in us. And so that's been really nice and refreshing.
That's awesome. And I know you work a lot with the VA, and studies have shown that migraine is a lot more common among veterans than the general population. So,
Yes.
what could you tell us about the unique needs of veterans living with migraine and how Cephally has been able to help?
So it is a very unfortunate statistic that for our veterans that they suffer from migraine more often than our every other day people. It's a terrible disease to have and something to live with. In the veteran medical center areas, we're able to kind of get into some of the areas that maybe other resources may not be able to, simply because we have an amazing training team that goes anywhere we send them. And then we have a lot of hands on the back end too that offer the trainings, like I mentioned, virtually. And so we are in every VAMC in the US. So if you are a veteran and you are watching this and you're curious about cephaly, go to your VAMC, ask your neurologist about cephaly, and if they are not familiar, they can find someone who is, because we are established in them, and that has really helped with the accessibility. And the VA covers for patients, and so that's a really wonderful thing for them. Nothing makes us feel better than giving back to those that gave so much for us.
And then when you think about the people behind Cephally, your teammates, the clinicians and partners you work with, what are some words that come to mind?
The number one is compassion. Our team is full of compassionate people, and it's not just for each other. We're there for everybody. We're in each other's corner. I just messaged somebody on my team right before this that teamwork, makes the dream work. I'm just offering teamwork constantly, but we're all doing that. But it's also for our patients. I mean, we're all willing to step up and help patients anytime they need it. So we all do what we call coaching calls, which is where we help walk patients through troubleshooting their device if they're having issues or if they don't feel like they're getting the outcomes that they were hoping for. We'll even walk them through getting them to their what we call their sweet spot and making sure that they're getting the most out of their device. So I really think that compassion is something that we all display here really well on every level.
Yeah, and it's also helpful to have that coaching through the device because if you just handed the Cephally device, someone might be like, I don't know what to do with that. So it's really helpful to have that step by step from someone to teach you how to go into the treatment modes and where to stabilize the intensity. So that's an important thing. Everyone who gets a device, or even if you're just interested in Cephally, you can book a free coach call on our website, and one of our Cephally coaches can help and answer any questions you have. So, is there any memory that captures what it feels like to be part of Cephally?
Oh man. Well,
I
there's a
know it's
lot.
a tough question.
That's a deep one, Allie. No, I think so. Anytime I get to go in the field and talk with patients and clinicians and things of that nature, those are some of my fondest memories. As I guess on like a professional level, on a more like personal level, being a part of Cephally, like I said, compassion comes to mind because I see it in everything that we do for each other and just coming together as a team constantly. I don't worry about it when life happens. I don't have to worry about what my boss is going to say. I don't have to worry about my colleagues being mad at me because I'm going to drop the ball on something. And we are a very compassionate, a very big teamwork atmosphere. And I have a lot of memories that are, silly, goofy, but also more meaningful on the aspect of when I needed my team, they were there for me. And that's a big part of, what keeps not just me here, but keeps me going. I want to help my team. I want to help the people that help me. And so it's a really good environment. And I'm really proud to work for a company that, models that and embraces it daily.
I definitely think too the empathy is very present here. I think when you know people who live with migraine and are working with people who live with migraine, you kind of see what that life can look like and how much it takes a toll on that daily life. So I think it makes you a better, more compassionate and empathetic person in general. So that's something that I think CEFALY as a whole should be proud of to have those people.
Yes, for sure.
So, if someone is listening and doesn't know much about Cephaly, what do you hope they'd understand after hearing from you?
I hope that they would at least give us a try if they're suffering from migraines, that they would feel confident and comfortable to reach out to us and know that we mean it when we say we're here for you and we're in your corner. We will work and advocate for you. If you are a veteran, like I said, please go to your local VA and inquire through there. We love giving back to our veterans, and we love that we're able to offer this device to them and some comfort. And then anyone else that's watching and wants to get involved, like reach out. We have the coaching link that Ali mentioned. That's on our website. It's easy to find. Our customer service line is also listed there, and we have a wonderful customer service team that would be happy to answer any questions. I just want everyone to know that the compassion is true. It is not a face that we put on. It is really who we are, and that we want to see you get back to life.
hmm And then you said a little bit before about advocating for yourself. Do you have any tips for patients that are trying to advocate for themselves at doctors? Because I know it's something that can be a really tough thing to do.
It can be, and it does take, I don't want to say confidence because you may never feel confident in trying to advocate for yourself. You may always have voices in the back of your mind saying you're crazy or don't speak up or whatever it may be. But don't listen to those voices. Listen to the voices that are telling you something's not right or that are telling you I need to try something different. And if the doctor is just one of those that happens to not have their listening ears on the occasional days that you're trying to talk, you are always able to go get a second opinion and see another doctor. And I strongly encourage anytime your gut is telling you, I need to try something different, that may include a different doctor. So don't give up on yourself. Don't give up on your loved ones. Are worth it and you matter.
Something to a tip we got from someone recently is like having a script to go to the
Mhm.
doctor so that once you're there and you're ready to tell them about what you're experiencing, it's not just kind of off the top of your head. You actually have something that can give you a little bit more confidence going into that appointment.
Yes, for sure. And always go in with resources if you have them. So, if you want to print something offline or you want to show up with the website pulled up on your phone, anything you can take in advance to kind of just have that extra bit of knowledge in your pocket is always helpful. It just makes the conversation go easier. And again, if you're already lacking confidence in standing up for yourself, sometimes it's easier to just say, here's what I want or here's what I'm trying.
So and do you know, do patients often talk to their provider about Cephally, or do most providers already know about it?
I think it's a pretty good mix because we do have a wide variety of providers that are onboarded with us and trained and CEFALY certified. And so there's a pretty good mix of providers out there that are ready to provide it to you. But there's also, like I said, so many more that we still need to hit. And those are the providers that patients are coming to that are saying, hey, I saw this ad, I heard this podcast, I went to this neurology conference and I met this person, or my mom has this, or whatever it may be. So we hear a pretty good mix from it. I will tell you, I don't ever hear that if a patient shows up asking for it, that a provider tells them no. So that's a really good, little benefit and bonus to the accessibility that we do have to patients is they're not having to go in and beg for it. They're able to just say, I want to try this. And because of the safety and efficacy behind it, providers are very open to it.
Well, I'd like to thank you for joining us today, Callie, not only for coming on today, but everything you do at Cephally. And I think conversations like this remind us what CEFALY is really about, helping people find relief and hope. So for anyone looking to explore new ways to manage migraine, CEFALY can be a powerful part of your relief toolkit. You can learn more at cefaly.com. And if you enjoyed this episode, please share it with someone who might need it. Thank you, Cali.